Parents do everything possible to keep their children from getting hurt or getting sick. But what happens when no matter how hard you tried, something still managed to go wrong? When you look at these children, what do you think they all have in common? All the children pictured here have autism. Hello, my name is Kate Robinson, and today we will be discussing a disorder that still puzzles science today. Many of you may be asking, what is autism? Autism is a complex neurodevelopmental disorder that is characterized by impaired social interaction and communication and by restricted and repetitive behaviors. All of these signs begin prior to the age of 3. Today we are going to talk about the causes of autism, screening for autism, treatment and maintenance, and a few quick facts that will help you understand how quick autism is growing. There is no one known cause for autism. Hereditability contributes to about 90% of the risk of a child developing autism. They are still unable to determine what genes are responsible for causing this. In rare cases, autism is strongly associated with agents that cause birth defects. Agents including exposure to a lot of metal, causing mercury poisoning, and the lack of folic acid, a vitamin that reduces many birth defects, is also said to play a role. Many other proposed theories include exposing a child to vaccines, certain foods, fumes, smells, and other things have been mentioned but not scientifically proven. About half of the parents of children who have autism notice unusual behavior by the age of 18 months. About 4 out of 5 of the parents whose children have autism notice unusual behaviors by the age of 24 months. There are several signs to look for when determining to go get your child evaluated for autism. Any of the following would be sufficient evidence to have your child checked. If your child does not babble by 12 months, if your child does not gesture, point, or wave by 12 months, if your child doesn't speak in single words by 16 months, and if your child doesn't speak spontaneous two-word phrases by 24 months. Any loss of language, social skills at any age would be a concern. This information is brought to you by Turkington, who is the author of Encyclopedia of Autism. As far as treatment and maintenance, there is no one known cure. There are special diets that are said to help with autism, including no gluten, which is wheat, and no casein, which is no dairy. There are medications out on the market right now that are not cures, but they will help to stimulate and also relax your child. Treatments need to be tailored to child's needs, such as special ed classes and behavior therapy sessions. These classes will help acquire self-care and social skills and job skills. Some quick facts about autism. Autism affects 1 in every 91 children. Autism affects 1 in every 58 boys, and it occurs 3 to 4 times more often in males than females. Autism is more likely to occur in a Caucasian male than any other race or gender. Autism is more common than multiple sclerosis, cystic fibrosis, or childhood cancer. These facts were brought to you by autismspeaks.org, and that website has a lot of information on autism. This little boy right here is my nephew, Deegan. Many of you are parents and would do anything to protect your child. And this little boy right here reminds me that no matter what you do, there's still a chance that something can go wrong. Deegan was diagnosed with autism at the age of 3. He is so special, he can light up any room. Over the past couple of years, they have tried several treatments to help Deegan, but none of them that seem to really help. He attends a special needs class in his elementary school and is on a special diet. There are different degrees of autism, and Deegan's is mild. He can still speak and interact with others, just not as well as we wish he could. Deegan is a very special member of our family, and we wouldn't know what we would do without him. He definitely knows how to bring a smile to a frowning face, and also knows how to push your buttons, but he is so loving and caring. We definitely see Deegan's autism getting better. Not sure if that's due to his age because you can grow out of it, or if it's being around others, but it just goes to show that no matter what life throws at you, just roll with the punches and know that if you work toward a goal, you will eventually reach it. That's my speech.